Hi everybody, and in this video we're going to demonstrate a high velocity, low amplitude thrust known as the lift-off adjustment for the CDJ, Cervico-Dorsal junction, but can also be used for T1 down as far as T4. Now in this case the patient is smaller in stature than the practitioner, so it's appropriate to use the standing lift-off technique, but if you have the opposite balance where the patient is larger than the practitioner, you may also use this in a seated position. So to complete this technique for the lift off, we're going to use a towel. So a small tea towel will work, but if you have a smaller, thinner towel, you can roll it as such and can be used the same. So we're going to turn the patient sideline for demonstrative purposes, and we're looking to adjust T1 to T4. So what we do is the anatomic level of T3 is roughly at the superior angle of the scapula. T7 would be the inferior angle of the scapula, roughly. So if we go to T3, drop down one segment, and we're going to place our towel to brace across at the T4 level. So from here, the practitioner uses a split stance down at our feet. So we place one foot just behind the patient's heels, and the other foot is behind. The reason we do this is because when we use the lift-off technique, we start in a forward position and we drop back onto our rear foot for stability, for our own protection, with our body in an upright position. So what we do from here is we ask the patient to place their hands interlaced and locked over the top of their head. The practitioner steps in, and this particular technique works well when we have a patient that is smaller than the practitioner. If the patient is larger than the practitioner, this is advised to be done from a seated position, as in the patient seated and the practitioner standing behind. So we pop one hand behind across the back of the neck, the other hand across, interlace our own fingers. We then ask the patient to place their hands on the practitioner's hands. We ask them to engage a light squeeze with their elbows, look up to the ceiling. Some practitioners say look down. I prefer the look up. I feel it locks the neck more effectively, and we're blocking at the T4 level. Now, to find our restrictive barriers here, we lightly squeeze. We can either slightly flex and or extend at the segment, side bend at the segment, holding the respective segments, and add a rotation as respectively needed. But what realistically we need to do is to auscultate the patient around. We have to ask them to trust us on the fall backwards, and then we gather up, collect all the barriers, keeping the patient with the elbow squeezed, looking up. We pull backwards and lift. So there we have it, guys, a nice simple technique called the lift-off technique for the upper thoracic region, using the towel as a block at T4. So we hope you enjoyed the video, guys. Thanks for watching.